Welcome. My name is Oroo, and the topic I'm going to talk to you about today is wheelchair sitting and positioning. Now, think about this. If you can trade places with a 90-year-old stroke survivor with a left side hemiparesis and poor trunk control, seated in a regular wheelchair without any positioning devices, or trade places with a 70-year-old diabetic patient with stage 1 coccyx pressure sore in a wheelchair without a seat cushion. The patient's discomfort in the wheelchair impacts their comfort, function, and overall well-being. The outcomes for this course include defining and demonstrating understanding of functional sitting posture. Number 2, demonstrate competency in rectifying functional sitting posture anomalies. And the expectations for this course include the instructor will introduce general concept of sitting and positioning. The participants will appreciate the positive impact associated with proper sitting and positioning. And the instructor will prepare the participants in identifying positioning deficits and be able to apply corrective measures. What is the functional sitting posture? 90 by 90 by 90, that is 90 degrees hip flexion, 90 degrees knee flexion, and 90 degrees ankle flexion. And of course, neutral trunk alignment must be maintained with adequate back support, adequate head support, and adequate pressure relief. Positioning issues affect patients in various ways. They do result in falls, compromised skin integrity, affect performance of self-care tasks, and results in increased care by staff members. There are various solutions to specific positioning deficits. For example, for lateral leaning, the lateral stabilizer or bolsters do solve the problem. For anterior leaning, reclining the back of the chair, and this has to be a high back reclining chair, by the way, or using a seat wedge cushion can solve the problem. For inadequate pressure relief, air cushions or gel cushions tend to solve the problem. And for inadequate lower extremity support, foot pedals or foot paddies or foot body cushions do help. Proper wheelchair positioning promotes skin integrity. It promotes comfort. It enhances function or independence in self-care performance. It enhances mobility and it improves socialization and self-esteem. Now, let's test our knowledge. I have a two-question quiz. It's multiple choice. Quiz number 1. This question is the most appropriate for a patient with Cossack's pressure sore. A. Palmar cushion. B. Rojo cushion. C. Foam cushion. And I guess if you agree with me, it is the Rojo cushion. Number 2, dash is used to correct inadequate lower extremity support. A. Head support. B. Footrest. And C. Seat cushion. And again, if you agree with me, I'm going to choose number B, footrest. We have a responsibility to the vulnerable population we serve to ensure they are properly positioned in the wheelchairs to promote comfort, socialization, function, and mobility. There is no magic bullet to positioning. However, knowing to identify the deficits and come up with corrective measures or refer to experts will help our clients lead a more comfortable life.